Hello there. I'm Trevor Sexton. I'm a student at Southwest College of Naturopathic Medicine, and I will be graduating in 3 months. I'm very excited. By the end of this year, I will be a doctor. And I'm not here to talk about that. I'm going to ask you a question first. If you're kind of hungry and you're presented with your favorite dish, your favorite meal, it's right there ready for you, or you could choose to not eat for a day, and then after that day, maybe eat a very healthy vegetarian meal, or just something very healthy. And most people would choose this plate of food, especially if they're a little hungry, because they're getting hangry. But I'm here to talk about the other choice, which is fasting. Fasting specifically to help rheumatoid arthritis. So I've had arthritis since I was 8 years old. And all my life I've thought of how I'm going to learn how to get rid of arthritis. I'm going to become a doctor, and I'm going to treat everyone with arthritis and help them get rid of arthritis. Biggest thing I've learned for myself is that fasting can have a huge effect on reducing my pain and my inflammation. There's a report, 31 reports, it's a study, it's an article on PubMed, 31 reports of fasting studies in patients with rheumatoid arthritis. And the pooling of these studies showed a statistically and clinically significant beneficial long-term effect. It went into detail with some of them, but it was mostly just saying that fasting benefited a huge portion of the patients with rheumatoid arthritis, and then when given this type of diet or that type of diet, they did worse or better, etc. I'm not talking about the diets afterwards. Actual fasting improved almost all of the patients in all these studies. I'd like to see a little more specific detail on a study, perhaps that they check, the blood work along the path of fasting, or soon after, and see lowered inflammatory markers, etc., or an RF factor that decreases because of fasting. Those studies I didn't really find. I'd like to, but let me just say that there's a few doctors out there. Dr. Goldhamer has a fasting clinic in Santa Rosa, California, and it's called True North. But something he says on his site is that the possible cause for inflammatory diseases in general, but rheumatoid arthritis, is leaky gut. And he says that the absorption of antigenic substances into the bloodstream as a result of increased gut permeability appears to be a factor in the aggravation of rheumatoid arthritis. So things are leaking through the gut and causing this inflammation in my body, or anybody's body with rheumatoid arthritis. And fasting can help to normalize that gut permeability and ease the transition to a health-promoting, low-inflammatory diet. Often people, it's hard to fast, but two, a lifetime of eating super healthy is very difficult to just start into. It takes a long time to transition, but fasting can actually speed up that transition to encourage healthy eating, thus encourage low inflammation in the body. It's here. So we fast, we eat healthy, arthritis goes away. I myself am flabbergasted and amazed at the simplicity of it. There's a Dr. Furman who's treated over 500 patients with arthritis and had success. It sounds magical, but it's so simple. We let our gut rest, we let our bodies rest, because fasting has to be resting, and people heal themselves. The body heals itself. And I just want to say that from personal experience, that fasting truly is an effective way to reduce arthritis symptoms. Thanks for watching.